We can now say quite confidently that 12% of melanoma patients have NF1 as their primary driver event, and that's kind of interesting because so far we knew about the BRAF mutant melanoma, which were 50%, the NRAS mutant 20%, and we didn't know really about the rest of the 30%, but NF1 is this kind of one of the missing pieces that characterizes another subset. Because NF1 and mutated melanomas activate the same pathway as BRAF and RAS, and MEK inhibition works well in these patients, that's obviously a clear strategy. And we tested it in vitro, and it seems to be quite effective in a subset of cell lines, but there's primary resistance that we don't fully understand. To test this in patients, we need trials, and I know of 2 ongoing trials, and I would hope that oncologists that have a patient that is BRAF wild type and has failed other therapies, that they potentially enroll them in these trials, because they either going to they're going to molecular type these patients, this wild type patient, and hopefully find the NF1 and then start MEK inhibition. And the one trial is the GEM trial. It's a nationwide trial. It's GEMM that will sequence those patients in many modalities, clearly characterize them hopefully for the NF1 status if present, and then also hopefully work towards MEK inhibition. And the other one is the NCI match trial, which is a little bit broader trial, maybe not so specifically for BRAF wild type melanomas, but is also potentially useful. And the NCI match trial is a basket trial where they're going to sequence for a couple of genes, and NF1 is among them, and there will be an NF1 subarm which will be treated for MEK.